I think it takes a special person to work in a children's hospital when you see such innocent kids going through something. When I got to children's, I was just swarmed with people who were so happy to be there to take care of me. It reminds me of just all the kids that are there and how much help they're getting.
I got the best nurse, and she's nice, really, really nice. And she's playful.
Every time I tried to cry, they blew bubbles. Popsicles. They got different flavors and stuff. They got blue, red, and what else? Green. And this is my pacemaker.
The way the kids are treated, it means a lot. So when it's a child, you have to really have extra patience, extra love.
Thank God there are people with philanthropic hearts. There are people that want to take care of the children of this community.
The community has the faith to, over generations, keep investing in itself.
It's a great example of great vision, transformational potential, incredibly generous donors stepping forward and saying, find the very best, let's transform care.
Everything changes and everything evolves, and in this case, it's all been for the better.
Everybody being willing to compromise for the greater good. I don't think anything will have had the result any place in the country, probably in the world, is what's happened here.
In 1913, there were no antibiotics. Whooping cough could kill. Polio was an epidemic. Dr. Michael Hoke, an orthopedic surgeon, began providing charitable care for children in a downtown Atlanta mansion spared from destruction during the Civil War. Dr. Hope, as he was called, cured a boy of a serious bone infection. And the boy's grateful aunt, Bertie Wardlaw, began raising money for a hospital for crippled children. Bertie enlisted the help of financier Forrest Adair and the Scottish Rite Masons. And the Scottish Rite Convalescent Home for Crippled Children opened with 20 beds on September 15, 1915. Housed in 2 rented bungalows on West Hill Street in Decatur, it provided care to children free of charge.
A number of times, the Scottish Rite Masons would dig in their pockets and come up with the money to meet the payroll. At one time, it was all free care, but finally, patients started paying if they could afford to pay.
Within 4 years, the hospital added 30 more beds to meet the growing need. The hospital was renamed Scottish Rite Hospital for Crippled Children to recognize its expanding medical services.
We went by the first building, and then into the second building is where I remember going. There was a good-sized waiting room that the children played in while they were waiting. What they did to me seems like impossible, to take a child that young and straighten that foot out and not have any problems with it. It's a miracle, really.
In 1916, Thomas R. Eggleston Jr., a prominent insurance agent, died, leaving $100,000 in his will to buy land and build a children's hospital. He asked that it be named in memory of his mother, Henrietta Eggleston, who had lost 4 of her 5 young children to childhood diseases. Thomas, the sole survivor, became a successful businessman and founding donor of the Henrietta Eggleston Hospital for Children. World War I and inflation caused the trustees to delay construction. But in 1926, they bought 15 acres at what is now the intersection of Ralph McGill Boulevard and Wabash Avenue in Atlanta. On October 15, 1928, the hospital opened with 50 beds.
Eggleston is one of the places I remember from my very young childhood. Mother loved that place. She was the first intern, and she never ceased to love Eggleston. Mother was the first female pediatrician in Atlanta, and she admitted the very first patient. I was a patient at the hospital several times because if I got really sick, she would shunt me over there. I remember the building so well. There was a very pretty formal garden there.
In 1929, the stock market crashed and threw America into a panic. The Georgia economy, already suffering from the attack of the boll weevil, was hit doubly hard. In Atlanta, as in other cities, banks, factories, and community institutions were struggling or closing.
Back in 1933, the Scottish Rite Hospital for Crippled Children was getting ready to shut down. So the two athletic directors at Tech in Georgia got together. They decided to play a freshman game on Thanksgiving Day in 1933. It was so successful that played the game for 60 years, but for the first 20 or so years that they played, the proceeds from that game actually met the net operating expenses of that little hospital and kept the doors open, which is amazing. It was not uncommon to have crowds of 45,000, 48,000 people show up on a Thanksgiving Day afternoon after they had their turkey to watch the Stars of Tomorrow for Georgia and Georgia Tech.
In 1956, Eggleston Children's Hospital signed an agreement of operation with Emory University. Emory provided 5 acres of land at the corner of Uppergate Drive and Clifton Road, and construction began on a new Eggleston in 1957. On April 20th, 1959, the hospital moved into a new campus with a capacity of 100 beds. And a new era began.
I lived since I was 4 years old with my heart stopping, going to tachycardia, and basically what I felt was flatlining at times. I had had 2 heart attacks at the age of 10. It was a very painful disease. When I got to the hospital, what I could remember is the feeling of hope. There was a lot of research that was used in my heart. They were going forward and they were pushing the envelope with new medicine. Essentially, the surgery that's now being used in kids with heart disease. I was one of the first ones in the country.
As Eggleston grew, the hospital began performing kidney, liver, heart, and bone marrow transplants in children, developed the first kidney dialysis program for children, and became the first in Georgia to offer ECMO, a revolutionary technique that can bypass a child's heart and lungs for days, giving the organs time to heal. In 1969, Scottish Rite began its major transformation into a full-fledged medical center. In July 1976, the hospital relocated to North Atlanta in a brand new 50-bed facility named in honor of Wilbur and Hilda Glenn, who donated the land for the new building. The holding company became the Scottish Rite Children's Medical Center. Scottish Rite greatly expanded the hospital's intensive care, emergency, and surgical services. The hospital also created a pediatric pulmonology program, a center for craniofacial disorders, and a sleep disorders program. Scottish Rite established the first full-size emergency department for children in the region.
After you operate on a patient, you are bonded with them for life.
Marcus Nickel was 9 years old. He was riding a skateboard in front of his house when the skateboard sped out of control and across an intersection. Marcus was struck full-on by an SUV.
I immediately climbed underneath the vehicle and just laid there with him until the paramedics showed up.
He was breathing, but he was not moving. We didn't give him an hour to live. There was absolutely no doubt. this kid's gonna die.
He had a big skull fracture with what we call a subdural hemorrhage, blood underneath the covering of the brain called the dura, signifying significant injury. When he came into the emergency department, he was very close to being brain dead.
Less than 30 minutes after Marcus reached the hospital, surgeons at Scottish Rite removed the left side of his skull and evacuated a blood clot, alleviating the tremendous pressure on Marcus's brain. In critical condition, Marcus was moved into the pediatric intensive care unit.
He was still bleeding out of everywhere. And we were all shaking our head and thinking, I don't think he's gonna make it through the night.
Both of his lungs were collapsed, broken ribs. The machines were breathing for him. I just remember looking at his chest rising up and down, and he didn't look real.
The intensive care staff slowly weaned Marcus off the sedation. No one knew if Marcus would come out of his coma. If he did, would he still be Marcus? About 4 days later, Marcus woke up.
Volunteer brought a little white dry erase board, and I wrote "Hi" to Marcus on it and gave him, the pen. I said, "Here, you want to draw?" And he wrote, "It is me."
And it really helped me move and learn how to read and write all over again. I could, tell sentences and they'll actually make sense. I could, play with my friends and talk to them how I usually would. I really like what the hospital did because I could have died.
By the 1970s and 80s, Scottish Rite and Eggleston had evolved into major pediatric centers, with many specialized diagnostic and therapeutic services. Scottish Rite added a 200-seat amphitheater for medical teaching. Eggleston served more and more children with complex and unusual diseases. In the 1990s, the healthcare industry began to shift dramatically. Reimbursement issues, changes in insurance coverage, and staff shortages put both hospitals under serious pressure.
The anticipation in healthcare back then was that with managed care coming at everybody like a freight train, that Atlanta was going to need less in terms of pediatric hospital beds.
Both of our data said Atlanta is probably not a big enough city to support 2 independent children's hospitals.
Nobody anticipated back then that Scottish Rite and Eggleston would merge and that there would be a children's health care.
Culturally, there was a big difference between the two. Eggleston being more academic and research-based, Scottish Rite being private practice.
There was distrust back and forth, and to the extent that there was competition in programs, it was not healthy competition.
We're spending a lot of capital to compete with each other, that at some point we take the risk of maybe the city not having either of us, that we both become parts of adult systems.
Both hospitals were cherished in the Atlanta community. Each had a strong identity, powerful supporters, and passionate volunteers. Each had its own long-standing traditions.
We had a dinner at the Downtown Capital City Club, and we had 3 or 4 trustees from Scottish Rite and 3 or 4 trustees from Eggleston. It wasn't to negotiate, it really was just to understand better. We agreed that statistically speaking, children got better outcomes in children's hospitals versus being in pediatric floors of adult systems. And that statistically is proven. And then the real, to me, point of it, I said, really as trustees of these hospitals, they're not our hospitals. These are the community's hospitals.
In 1998, Eggleston and Scottish Rite merged to become Children's Healthcare of Atlanta.
When we came together at the very first meeting of the combined board of the two hospitals. We met in a conference room at King and Spalding. When I left that day, I knew that it was going to work.
As loyal as we are to our brand and our institution and its heritage, isn't the real heritage of philanthropic commitment to trying to get the best outcome for our children.
Their bald heads immediately point out that there's something terribly wrong. And I think that sometimes as an adult, it's a shock to see kids with bald heads, because it's almost a symbol of how life-threatening the illness is. Once an adult gets past that, what you still mainly see is the kid. The disease is always secondary to the kid.
I would never have chosen to go to a cancer center to see kids. I was very nervous about going because I wasn't sure how I would handle it. I remember they wanted to ask us for $25,000, and I thought, well, this might be a connection that might really hit home with us. We're now approaching $100 million in gifts. It all started at Eggleston with our $3 million donation. And then when the two hospitals merged, Scottish Rite and Eggleston, we then set up the cancer center at Scottish Rite, where it became the Aflac Cancer Center. When you look at the cure rate, what a wonderful thing it is to see these kids live a healthy life going forward. I just believe that we can find a cure for cancer.
I have a different opinion now about children without hair. I think they're beautiful, and they represent strength and hope and courage. But that night, I just saw cancer. Your son has leukemia are in the top list of the worst things you could ever hear. I didn't know that night if Joseph and I would survive this. He was so afraid. But they literally have taught us how to survive this. Kids shouldn't have cancer, you know, they just shouldn't have cancer. We have hope. We have a lot of hope. That's the greatest gift you can give a mother.
Leukemia makes me sick, but the doctors helped me to get that away. So the medicine is getting that away and get the new blood come back and get the old blood go away and get the new blood come back.
Toward the end of World War II, people began to become aware of a dramatic inequity in healthcare dating back to the city's founding. Due to the policies of segregation, African Americans had very limited access to doctors and hospitals. Not surprisingly, Black Atlantans had a higher mortality rate than white citizens.
In 1947, the Atlanta Urban League created a report which outlined the dismal options for non-indigent African Americans for health care. And Grace Towns Hamilton, who headed the Atlanta Urban League, approached Hugh Spalding Sr. about this issue, who in turn rallied support from the community.
Emory University donated 3 acres of land across from Grady Hospital in downtown Atlanta for the new facility, which would be operated through the Grady Health System. The new hospital, named the Hughes Spalding Pavilion, opened in 1952, and at first served both children and adults. The first medical director was Dr. Asa Yancey, who developed the first accredited surgical training program for African American physicians in Georgia. Dr. Yancey was also the personal physician of Martin Luther King Jr. In 2004, Children's Healthcare of Atlanta and Grady Health System jointly announced plans for Children's to provide pediatric services at Hughes Spalding. Children's began managing the hospital in 2006, and in 2010 opened a new building at the same location, with expanded facilities, updated equipment, a primary care center, a sickle cell clinic, and an asthma clinic.
Hugh Spalding is fabulous now. The exciting thing is if you closed your eyes and you were put right into Hugh Spalding, you would feel like you're at Eggleston or at Scottish Rite. It has all of the wonderful doctors and the staff that were there before, but now they have a facility to match the knowledge and the care that they were giving prior.
I remember when I had a stroke when I was 7 years old. It was terrifying. I woke up and I tried to walk, but I couldn't. I kept falling. We got rushed to the hospital.
I've known Datisha for a long time. She has hemoglobin SS, which is the most severe form of sickle cell disease. She'll have fevers, pain in her chest, and trouble breathing. There's a lot of suffering related to that. We've had her on chronic blood transfusions since she's probably about 9 or 10 years old.
When a child with sickle cell is sick, everybody's whole life stops. The whole family's life is centered around this child's illness. Having to be transfused every month is a challenge for the family, but they've conquered it and they've done very well over the years.
I was young when I had Datisha, so I grew up fast. It's nothing that you as a parent that can do. Just be there, that's the hurting thing.
In the last year, she's had some trouble with some complications of her treatment. She was taking a medication to help her remove iron from her body, and she lost vision in both of her eyes, and we think it's related to the medication.
I woke up and I couldn't see like out the left side of my eye. And it was scary because that's the only good eye that I have.
After stopping the medicine for a few months, her vision has improved dramatically, but we've needed to change the way we give her transfusions for something called exchange red blood cell transfusions.
A lot of the sickle cells are coming out of my body, and a lot of red blood cells are coming in. I'm hoping it's a cure. Maybe not for me, but for some of the kids who are starting in it.
It goes back to the early 80s, and I had a young woman who was working for me, and she took a lot of time off, and her time off was spent with her child, who she had adopted, who had some kind of disability that nobody quite understood, but he was a non-functioning child. He didn't speak. This was beyond anything anybody had ever seen before.
He goes by Matthew. He is incredibly handsome, very loving and gentle, loves bugs and insects, horses, swimming, fish, whales, anything that has to do with water.
Walt has gifts that if you didn't know him well, you would never be aware of. He is this bright little boy.
Walt was developing, as all children should, but as he approached 12 months of age, we lost eye contact, began to notice that he wasn't talking the way he should. He was having difficulty keeping down solid foods.
That was heartbreaking. And I think the challenge was that we'd never seen anything like it, and so we didn't know much about autism at the time.
One of the aspects most difficult with autism is the financial burden that it places on parents and families. That's a lot for people to bear.
Autism is an enormous public health challenge. About 1 in every 68 children has autism, 1 in every 42 boys. So we're talking about over 4 million Americans with autism.
We saw families who were broken. We saw families who had sold their homes in order to take care of their kids. And I said, we're going to open up something. We had 2 trailers, and we had these 2 doctors, and before you know it, we had lines of people coming out of nowhere. We decided to build the present facility because we couldn't handle the crowds. Children's Healthcare of Atlanta, they came in, and of course history has been made from that point on. Today, the Marcus Autism Center is the leading researcher for autistic children in the world. It is a miracle, and I'm very happy about it.
When we brought Eggleston and Scottish Rite together, what we were able to see is that 1 + 1 equaled about 10.
It ultimately helped to ensure the preservation of specialized pediatric care for children.
Children's health care has been a great success. It provides a service, and it does it better than anybody else.
I'm so excited to watch the next leg of this journey because we're really just starting to accomplish all the things that we can for the future for kids.
What we're doing in research can not only improve what we're doing at Children's Health Care, but it can improve what we're doing beyond the borders of Georgia and beyond the borders of the United States.
I think it'll continue to grow, and I think it has the potential to be the greatest hospital for children in maybe in the world.
They have experience with children because it's a children's hospital. They help me feel better by encouraging me. They help me a lot when I'm sick.
I can have like hair now. After my CT scan and PET scan, they told me that I didn't have cancer anymore. Me and my mom were dancing in the kitchen. I wouldn't be here right now if it wasn't for children. Well, it saved my life.